when there is traffic, if you pass the between car when there is female, sometimes it can be the cause of it making accident because the female can stop from moving between the cars. I can be safe while riding back without a female because I'll also be mindful to be smart in riding back without a female because on the main road, when there is traffic between cars who pass, the female can permit to pass between the cars. So that the reason I decided to take the female for the feel relaxed.
We want to clearly say that the story caption that the Minister of State is in any kind of extra support to any other candidate is false, is malicious, it is baseless. Whatever the source is, we think that it is intended to distract our voters, and we call on our electors to remain focused, to listen to the leaders as the leaders have asked them to go and vote for the candidate.
I was reading in the newspaper, someone said, Liberia people will get Joe, we are one-term president. But on this birthday, I want to say to them that God will make sure that our mouth will be closed. I will defeat more than 2018. Because I am the voice of the Liberian people and the Liberian people love me.
Let the issues to develop our country should not be tied around politics. It should not be politicized. We want this country to benefit from what is truly deserved for the national cake of this country. But to holistically want to commit this country for a few or a particular group of Lufian, I think that's totally unfair to the vast majority of our people. I will never come here to you today and say to you because I am a sedition, and I think everybody in this country should be sedition, and say because you're not a sedition, you do not have the right to survive. No, our messages will define us. We think this country will be far greater than what it is when its sons are united, when its sons are reconciled. We are against division in this country. We go against people, few group of people who continuously want to delve themselves into actions that send a misconception about our country. My fundamental issue is that the leaders of this country must take leadership. They got to take leadership. The leaders of this country.
I woke up in the morning full. I woke up, it's last day. I want to go.
Good morning, folks. Good morning. What a pleasant word I can welcome you this morning. Good morning, Liberia. It always feels good to be back here on the program. Your morning breakfast show, where issues are discussed for the betterment of our country.
African soldiers who fought for freedom. I want to salute African soldiers now.
On today's edition of the program, today's Thursday, the 29th of December 2022. Good morning. Good morning, Liberians. Good morning to the people of Grand Jita County, my county of birth. Good morning to the people of Lofa. Good morning to the people of Nimba, Maryland County, River G, Sino, Grand Crew, Grand Bassa, Bonk, Bomi, Grand Kitmount County, Lofa, River Says, My Gibi, Bapulu, and all Liberians, if you found yourself in the 15 sub-political divisions of our country, good morning. Welcome to Good Morning Liberia.
From political nonsense.
All the African soldiers, our salutation this morning.
Oh, save your people from political yabis.
We had many things to talk about. And coming up 9 o'clock, just so I have you reminded, we'll bring you a live coverage of The year-end media engagement with the Monrovia City Mayor, Jefferson Tambakoji, where he will talk about many key things: the growth, the gains, the losses of the MCC, the progress made, and other things talked about. At 9 this morning, our outside broadcast crew will be at Monrovia City Hall to bring you their year-end media engagement with the City Mayor Jefferson Koji. The President of the Republic of Liberia dedicated yesterday officially the Emory Hospital here in Bopolu City, Bapolu County, where there are lots of commendations to the President and his government and the people and the government of the United Arab Emirates. We'll talk about it this morning. Yeah, so keep listening. Take a very short break. We'll be right back. And I introduce my colleague. Together, we're going to ride you through up to 9 o'clock, at which time we join our outside broadcast crew to bring you the year-end media engagement with Jefferson Koji, the mayor of Monrovia.
I want to salute African soldiers. African soldiers who fought for freedom. I want to salute African soldiers now. African soldiers who fought for freedom. Some are dead and some are living. Those that are dead are still fighting. Those that are living are still fighting. Martin Luther King, African soldier. Ofebani, African soldier. Robert Mugabe, African soldier. Samura Machel, African soldier. Basharu, African soldier. Basharu, you be African soldier. Can I count that African soldier? About Tokunde. Show your power and free your people now. From economic hazards.
Welcome back, folks. Good morning, and welcome to Good Morning Liberia. And today is Thursday morning edition of the program. Like I say, always feel good to be back on the radio, to be here as always, and talk about issues of national concern, issues confronting the Liberian people, issues that should be in the interest of the Liberian people, and what are way forward, what are the government, what government is doing to curtailing those issues confronting with the common people. And yeah, we will talk about it this morning. Like I told you, the president of the Republic of Liberia, His Excellency President George Weah, on yesterday dedicated this state of an art Emergency Hospital in Bopolu City, Bapolu County. I praised the president of the United Arab Emirates, Sheikh Mohammed bin Zahar Al Nahyan, for his effort to improve the health sector in Liberia. You know, this is something at times when the government does right, we commendate them. If the government goes contrary, not in the interest of the Liberian people, we also put their feet to the fire to talk about what necessarily need to be done for the Liberian people. So I would like to welcome my colleague. Good morning. Salam.
Good morning to everyone. Thank you, G.
Mm.
And it is good to be here this morning so that we can be able to inform the Liberian people
Okay.
about the major happenings in our country
Mm.
and continue to contribute to the well-being of Mama Liberia.
I was
made a promise and the promise was fulfilled. It is very important. I think Bapur is one of the counties who, when it comes to basic health care, it has been a challenge for them. The government played a role breaking forth that initiative to the people, not just for Bapuru, but other countries going to benefit from such a initiative. We are hopeful to seeing the citizens of the county and that of the health practitioner, maintaining the facility. It's not just about constructing it; it's about the maintenance play a very significant role.
This is one of the
Yeah,
things that
one of the
people
things.
are questioning on.
Yeah.
There's question about it. That the hospital, okay, it's already been built, it's been dedicated, and it's ready for services or provision. But how are those who will be at the clinic or the hospital being maintaining it? The maintenance aspect is very cardinal. The maintenance aspect is something that should be key, in terms of observing, because mind you, this is one of Liberia's problems in terms of maintaining things. Yes, the hospital has been built. Kudos to the UAE's government and kudos to the Liberian government. It's been constructed, it's been commissioned on yesterday. Those hospital authority or administrators, now the ball is in your court. It is your term to take care of the hospital. The government has played a part. The UAE's government has also played their part. It is you now. The responsibility is in your hand. You are now having the authority to make that place a better place. We can't have the hospital there and it's not being maintained. The maintenance has been poor. We've seen that to many hospitals in this country, many clinics, even some not limiting it to clinic and hospitals. There are so many things that have been built, that have been constructed. There are so many developments that have been brought in this country, but the maintenance of it, maintaining it, is the key problem. And this is something that I know the president will do. He will ask his people to do so. Because if not, we will just see the hospital just be clean there, beautiful. At the end of the day, he will come back to the same number thing that Liberia, things in our country cannot be maintained. One thing again, Salam, is having a hospital is just another thing, right? Number one of the things we talk about is maintenance and the aspect of drugs being there. You can't have the hospital and you don't have the necessary services being rendered. You can't go to the hospital, no drug, right? So our hope is that since the government have dedicated it, kudos to them, but they should take into observation or into concern key things about maintaining the hospital. The hospital is or will provide services to a huge or handsome amount of people within Western Liberia. The last time, if you can recall, when we went bombing, hospital and clinics, access to good health facility was one of the key things residents and people in that particular area were speaking of. They spoke about it. You have pregnant women will walk a far long distance just to go to hospital. When their children are sick, they will travel by land. Sometimes no motorbike, no
They have their own health area, the drugstores.
That's true.
Yes, that has been in the air for a very long time. The issue of you know, health workers at the various facility taking the drugs, sending it to their private institutions in the name of they want to improve their own place and they want to improve their businesses. That is so sad. That has been happening for over a long period of time. Sometimes when a patient go there, they will tell the people after they do the prescription, they will tell the patient, "Oh, go to so and so pharmacist, you get a drugs from there."
Sure.
Bro, in the country, the government brought in the country was small, but they were the same people who've been allegedly involved into the kind of acts. Some of the nurses, the pharmacists, some of them they have been involved into that. So when the hospital go out of jobs,
The president will not be in Bapudu. Even a health minister will not be there. I think Enfield representative will not be there. The Liberia medicine, I don't know how they call it, woman. Liberia Health Medicine Regulatory Authority, they will not be there. You as an administrator for that hospital, the human resource person, the administrator, the chief doctor, all of you have now this responsibility. The president and the government, like we told you, have already played their part. Even though they will stay and they need, a team responsible for the effectiveness of the hospital, like a monetary team.
Mm.
That place is very far, my brother. For people to be leaving from Bapuru to be coming to town to come to JFK for treatment, quality treatment. Now the hospital they already built. There is a massive, or there might be a massive relief that the people will not have to come to Monrovia.
Mhm.
Someone will not have to go to Vondruma. They will not have to go to Rapper Sports and other places to get some quality, or treatment, health treatment. They will stay right in Bopuru there and they will do their treatment. But how will that be done when the people who should or who are clear or who will be given the authority, they go ahead to spearhead the treatment and they do the treatment and they do the things we observe in rural area, rural hospitals and rural clinics is that the workforce is just so low. At the end of the day, you have one doctor who taking care of that whole hospital, big county. At the end of the day, if there are some major, or surgeries to be done on a patient, at the end of the day, the doctor not in the county, or the doctor is based with another person. So the hospital now has 100, bed hospital that have covered over 50, I think 52, 2,000 kilometer. The thing is, once you have the higher workforce, the people will still, get the quality health treatment. But if we get only one doctor, like in Granji at the Mato Memorial Hospital, we only got one doctor.
Mm.
So that big, they counted out how over 50,000 individuals, over 150,000 people in Granjide, in Zwedru, and you have only doctor. So if they are men there to do some major work on
Mhm.
patients,
Mhm.
sometimes the people gave up. They lost their lives. If you assign, people at our focus is specifically for the Emirates Hospital.
Mhm.
The hospital should not just be the building that the people, oh, the hospital there is
Yeah,
fun,
they found
they
right.
play big, they play, like, no, there should be an increasing workforce that will have the work being easy. That when you have people coming from bombing, some part of bombing, people coming from some part of low fast, some part of bomb, some part of came out, they will be able to, cater to them.
But I understand that the hospital there in Bapolu, the health facility they had,
Mhm.
they have the health workers will be transitioned to the Emirate Hospital in
Okay.
January. So basically, I think they need to increase the
The
workforce
workforce.
so that the people can have a smooth health facility, the responsiveness of the hospital, and also the health workers, the nurses need to be focused. Over the years and over the past time, people complain about the way in which the former manner in which the
And nurses
nurses
can
respond to them
to patients.
to patients. That is so saddening. The person can be sick and then you you
I mean, it's just
you are not focusing.
adding insult on injuries.
They say you are a nurse, so you must be able to console what the person in that kind of a situation. You understand? Why you doing your work and then you have to talk to the person? But yeah, your way you go sit down outside. We ready for you. Then they will be on the phone.
People can be on TikTok.
Yeah, they be on TikTok and all the kind of thing. They're playing with the phone and then they don't want to focus on the patients. It can happen, yeah. The other the hospitals in town, yeah, happening. The people can complain. We can see that. Look, you when you at a job site, you have to exhibit what we call professionalism, especially when it comes to that kind of area. Respond to the people responsibly.
Mhm.
Do not just sit there and when patient comes, especially from the ER or the emergency area, then you just sit down and say, no, you're way small. You're done reach.
No, even at that, you can even tell the people to wait, but that should be in a professional and
Very,
civil manner.
very professional manner.
Because
They will talk anyhow.
these people they go there, the first thing, especially for pregnant people, somebody is in pain and about to give birth. The first thing they say, I don't want pregnant you. What's that? Who does that? Professionally, as a professional nurse, you don't say that to people. As a professional doctor, you don't say that to people. The person in pain coming to the clinic or to the hospital and to be catered to. But he's telling it, he's saying all lots of words to the person. He added insult on injuries. The thing is, we should be professional in our discharge of our duties as a nurse, as a doctors, as a midwives. One thing I don't get is the midwives. You go to midwifery school, the thing they call even somebody who don't go to school, never doing midwifery. When they say midwife, meaning somebody that caters to people. You there to take care of people. Midwife. But they see midwives, you go to the nurse, some of them even I call it internship. They just misbehave. You should take care of every patient that will come to to the clinic, especially for the baby mothers and the babies and their mothers. Pregnant women, when they come, console them, talk to them, be patient with them. Many people can get sick. Some people can get abnormal sickness, mental sickness. They see people when there is a me or there is certain strategy that you need to put in place to talk to these people, to tell the people, be kind, be like this. But once you see the people there, you start saying harsh word towards them, So especially people get some people get quick temper, someone gets sick, they want to react.
Yeah, they want to react.
At the end of the day, something might differently happen. Let us be civil as a nurse. Be professional. Don't be on your phone on TikTok. Don't be on your phone on Facebook. Don't be on your phone on Instagram. You can do these things after work.